Now, do you have a niggly knee? Have you had a sore knee for years, and when it flares up, it stops your training, stops you on your tracks, and it's really frustrating? Well, if so, this video is for you. Kia ora team, Coach Brad here, all the way from the beautiful islands of Aotearoa. Now, I've been a physio for around 24 years, coaching runners for around 20. I've had 2 long breaks off running due to me not managing my chronic knee injury well. I didn't have a good relationship with my chronic knee injury. I was trying to push through pain rather than work with pain. The original injury was a medial meniscus tear. Now, the tear happened on the inside 2/3 of the meniscus. This is where there's really no blood supply, so full healing was never really going to happen. I visited a couple of surgeons, saw a really good sports physio, and they all agreed because there was no mechanical symptoms, I didn't require surgery anyway, but I had to be patient. I had to manage it. I had to rehab the knee really well. And the number one thing that I had to do was listen to my body, not push through pain. And let's face it, that's something that all runners do. Managing the knee means strengthening it. It means improving your balance. It means not overdoing it. Overdoing it. I mean, that's what runners do. We love to push boundaries. We love to better ourselves. We love to increase our weekly mileage. We love to... Now, as I said at the start of this video, I've had 2 long breaks off running. One of them up to a year. The reason? I was pretty bad at managing my knee. I want to share with you my 3 biggest tips for managing a chronic knee injury where there's no quick fix. And let's face it, surgery isn't always 100% effective. We have to take responsibility for our injuries. We have to be empowered to make sure that we're doing all we can with our daily habits to maximize function, especially if we want to keep running deep into old age. So, tip number 1, keep your weekly mileage within capacity. As you build your weekly mileage up, keep listening to your body. Don't wait for a whisper to become a shout. Keep an eye on those morning markers, knee pain, swelling, loss of range of motion. If that becomes an ongoing negative story, you've got to change your loading. You've got to change that mileage. Other little tests you can do is a simple hop test or how your balance is on that leg. Those little things can really give you indication if you have dysfunction within the knee. I tell my clients to make sure that they don't have pain more than 2 or 3 out of 10 for up to an hour after the run. If that starts to rise to 4 or 5 out of 10, you've got to make some changes. You can't just keep pushing through. You might find that you can't return to exactly the same mileage post-injury as pre. So for instance, you might have been able to run 5 or 6 times a week, but after the knee starts to flare up, you might only be able to return to 2, 3 or 4 times a week. Don't worry about that. Don't focus on what you can't do. Focus and be grateful for the running that you can do. Tip number 2, add in cross training. To maintain your aerobic fitness, if you're running less, you need to add in some cross training. So look at something that you enjoy. Add in some cycling, maybe some rowing machine or elliptical trainer at the gym, or even better yet, swimming. And if you're close to an ocean or a lake, swim there. It's so good for your overall well-being to get immersed into nature when you're training. I've personally found that cycling is an absolute win-win. When I'm rebounding from a knee niggle, I can still do some hard efforts on the bike without any negative impact on the knee. In fact, that cyclic motion without the impact is so beneficial. You get a fantastic cardiovascular workout and your knee feels excellent afterwards. So cycling is a fantastic cross-training tool. Tip number 3, flexibility within capacity. With any chronic joint pathology, it's imperative to maintain as much range as possible, but don't push it beyond the natural range of the joint. This can create inflammation, irritation and impingement of the joint. You can then create a guarding response, and that guarding response nullifies any extra range that you might get with excessive stretching. Managing a chronic knee injury is a marathon, not a sprint. Don't rush into trying to get that extra range. All you'll do is create irritation, and that irritation will create guarding, and then you'll find that you'll get a dysregulation of that movement pattern, which will really inhibit your ability to load more running on. So ease your knee into that end range. Hold it for between 15 and 30 seconds and try and get some micro chunks of stretching throughout your day. I've got a standing desk and I try and do some small amount of stretching between clients. And then when the knee starts to feel a little bit better, you can get some more stretching done with some yoga. So when you get the yoga involved, you also get the benefit of that isometric strengthening while you're looking at end range stretching within capacity. For the knee, start with the basics. Look at some quad, hamstring and calf stretching throughout the day. These muscles all cross the knee joint and they're a great place to start to try and allow that knee to move into as much flexion and extension as possible without irritation. No pain, no gain is not a helpful mantra when trying to rehabilitate chronic knee issues. Having a chronic knee injury does not mean you have to stop running. It just means you've got to train way smarter. You've got to listen to your body. There's even a recent study to suggest that running on knees with meniscus damage can actually be beneficial when the loading is right. You can't manage what you can't measure. So keep a training log so you can keep track of all of your sessions in terms of duration and mileage from week to week. Don't run blind. Find your sweet spot for activity, type of activity and flexibility. Remember, motion is lotion when it's done correctly. Please go out, earn those miles smartly. Listen to your body. Champion compassion, be kind, and I look forward to catching up with you on the next video.